That was a little earlier. Let's chat live to Phil now in Abuja in Nigeria. Phil, thank you very much. So is he still in this hospital, this first case? What's happening right now?
If I heard you correctly, you're asking if the patient is still at the hospital. What we know is that yes, the patient is at an infectious disease hospital located in Lagos State, southwest Nigeria. Health officials from the Ministry of Health and especially the National Center for Disease Control are definitely attending to him. According to the Minister of Health, Osage Nahire, he says the patient is, in a stable condition and is not showing any serious signs or symptoms at the moment.
In a way, this is a test. Were authorities able to identify him quickly? Was there a testing center? Was this all confirmed and dealt with very quickly?
Well, that's been the bane of discussion throughout the day since Nigerians woke up to the news. According to the Minister of Health, the patient came into the country on the 25th of February. He fell ill on the 26th, and he was confirmed as being infected by the disease, the coronavirus disease, on the 27th. So far we know that he touched down in Nigeria on the 25th. There are reports that he went to a nearby state, which is just a few minutes from Lagos State, that's Ogun State, for some form of business activity. But he was rushed to Lagos State, to where, of course, there's a more advanced facility to detect or diagnose the disease, where he was found. So far, the government says there is a massive, search for all possible contacts, as they call them, index. He's an index patient, but they are now looking for people that must have made some form of contact to him in the period when he was in Nigeria before he was discovered of being infected with the disease. Ogun State government has also said that they are definitely going to find everyone that must have maintained some form of contact to be able to also check if they currently have the disease. But the minister has said that Nigerians should maintain calm. There should be no need for panic, and also there should be some high level of hygienic practices, washing of hands, and also maintaining a bit of distance from people who sneeze or experience any form of symptoms at all.
So, Phil, as I understand, this was only picked up because he went to a doctor or a hospital. It wasn't picked up at the airport. What is happening at the airport? Is there increased vigilance there as well?
Well, thank you. I mean, there's been increased vigilance at the airports. That has been on since the beginning of the year, since the country heard of the coronavirus. But in fact, according to the Minister of Health, there's been some dispatch of rapid response, members of staff, health officials by the Health Ministry, because at this time the case has been confirmed. So rapid response have been dispatched to various parts of the international airports in Lagos, in Port Harcourt and Abuja, to intensify efforts to, diagnose or check for any possible case at all from passengers, people arriving or leaving the country. And so the minister also said that so far they've received some form of treatment protocol from China, which will help them improve their information about how to combat the coronavirus or contain it, and also how to treat the infected patient or patients, as the case may be.
And finally, you said there's a scurry on to find who he came into contact with. I mean, Nigeria is Africa's most populous nation, and Lagos is very dense. Is there a fear here that there are many more undetected right now?
Well, you're right to say that, yes, Nigeria is the most populated country, populous country in Africa. Lagos is also densely populated, over 20 million. But then, according to the Minister of Health, there's no need for fears because, I mean, you know, it's possible that at the time the man came into the country, he had not started, you know, exhibiting those signs as, you know, it's supposed to be able to spread to the next person. Also, the government is saying that his routine, his itinerary has been closely monitored, and the possible cases where people must have made contact to him, they're examining it, and they're going to be, you know, going after the people to ensure that they are in the health officials' custody for proper checks and all of that. But most importantly, there is some form of optimism as well with the fact that Nigeria has dealt with something close to this before. That's Ebola, where in spite of the population of the country, the government, the people were able to come together to deal with it and put an end to the outbreak of Ebola. So with that same, you know, spirit of positivity, people are expressing optimism this time that the same efforts, the same, you know, collaboration will see the end of coronavirus outbreak in Nigeria.
Good point there. Thank you very much, SABC News correspondent Phil Ihaza in Abuja.